Welcome to the Essence of Health Tea Time Podcast. I am your host, Dr. Shayla Toombs-Withers. As a double board-certified family and obesity medicine physician with over 12 years of experience in medicine, I teach motivated individuals how to achieve their desired quality of life while preventing and reversing chronic diseases. It's tea time. On today's episode of the Essence of Health Tea Time Podcast, I have a special guest, Dr. Jamie Evans. Dr. Jamie is a physician board certified in family medicine and psychiatry, and most recently in obesity medicine. She spent the first half of her career working as a primary care physician for a federally qualified health center, FQHC, in rural northeastern North Carolina. She then joined Array Behavioral Care in 2018 as a full-time psychiatrist doing emergency room crisis and inpatient consult liaison work. And she now serves as a medical director and co-chair of Array's Diversity, Equity, and Inclusion Committee. She works part-time in urgent care clinics. She also has a passion for mentoring students interested in healthcare. So thanks for joining me on the show, Dr. Jamie. I am so excited to have you.
I'm so excited to be here, Dr. Shayla. Thank you for inviting me.
Yeah. And for our listening audience, because both Dr. Jamie and I are physicians, we want to make it clear that we are not your personal physician. So we want you to remember that the information and resources shared here on the Essence of Health Tea Time podcast are for informational purposes only and should never be used as a substitute for direct medical advice from your doctor or other qualified medical provider. This information and resources are not intended to diagnose, treat, nor cure any type of disease or health condition and does not serve as medical advice for you personally. All right. So Dr. Jamie, we're going to dive right in here. As a specialist in psychiatry and obesity medicine, can you explain to us the relationship between obesity and mental health?
Yes, absolutely. It's a really good question. First, I want to just start by saying that, we have to understand that obesity in and of itself is a complex medical condition. It is not that fat is just fat. Obesity in and of itself is the excess accumulation of fat cells or adipose tissue. And what we now understand about them is that the fat cells are actually active endocrine organs like your pancreas or your thyroid in your body. They've got blood vessels, they have nerves, and they release hormones and other markers. So having said that, people with mental health conditions are twice as likely to develop obesity and obesity-related comorbidities like hypertension, diabetes, as well as having a higher risk of death than people who do not suffer from obesity. Also, people with serious mental illnesses like schizophrenia tends to have higher rates of obesity as well. And people who in general experience obesity tend to be subject to weight bias, which a lot of people know and understand. Weight bias is when people are either made fun of or discriminated because of having a higher, body mass index or, obesity. And that can contribute to depression, it can contribute to anxiety, contribute to eating disorders and substance use disorders. So it really can contribute to a lot. Another linkage is that both obesity and mental health conditions can develop in people who've experienced something called an adverse childhood condition or an ACE. And that is typically some sort of trauma in a person's lifetime, childhood, such as experiencing some sort of abuse, whether sexual, physical, or emotional verbal abuse, or witnessing some sort of traumatic event or domestic violence in the home. And so that certainly can contribute to the development of both of these conditions. Also, there are other factors that have been researched that can connect these two as well. One really big one is inflammation in the body. And so one of the things that we realize is that, again, as fat tissue is an active endocrine organ, it releases these inflammatory markers into the bloodstream. And this is really due to a breakdown of the barrier between the blood and the stomach and the stomach tissue or the blood-gut barrier. And that can raise the risk of conditions like cancer, specifically like colorectal cancers, kidney, endometrial cancers. It can cause a higher rate of stroke, heart disease, and diabetes risk, right? So we know that like specific foods can cause inflammation in the body. People may have heard about like pro-inflammatory foods, some of the good stuff that people like, things you should eat in moderation if you're going to eat them. So red meats, processed meats like bacon, refined carbohydrates. So those are like high sugar foods or things that break down into simple sugars like white bread, white rice, dessert. Having sweetened drinks, high sugar drinks like soda or tea, sweet tea, especially down here in the South where I am in North
Mhm.
Carolina. And so this inflammation and these inflammatory pathways actually can also not only affect, and release these inflammatory markers into the bloodstream via the stomach, but then you have this thing called the blood-brain barrier. That protects the brain from harmful substances like inflammatory markers. And so if you have this leakage or this propensity for leakage in your, blood-gut barrier, the same thing can happen with your brain. And so we're also finding that we can, develop a number of mental health conditions related to inflammation in the body as well. So it can contribute to symptoms like decreased pleasure or something we call psychomotor slowing. So that can be like a decrease in a person's thought or their movement, literally feeling like they're moving through mud, and those
Yeah.
types of symptoms that can be featured in depression. So
That
all of this is like,
yeah,
yeah,
that is
a lot.
and for the listeners, they're probably like, oh my gosh, that's a lot. But no,
Yeah.
what's the important to note there is that there are so many things in our body that
Mhm.
impact one another. And
Yes.
so I'm an osteopathic physician. And so one of the focuses in osteopathic medicine is that, the body is interconnected. And
Hmm.
one thing can play on the next. And what you
Yes.
said, it just is a great example of
Hmm.
that. How you can't just say, oh, the kind of how in the weight loss world you'll hear people like, oh, if I can just lose that tummy. Well, no,
Exactly.
there are a
Can't
lot of
spot
things that
reduce.
are right that are playing here, and so you can't, it's not just a one target type of
Hmm.
deal. And then the other thing you touched on was weight bias, and that's one of the things I'm excited about, the field of obesity medicine
Hmm.
and specialists like yourself getting that fellowship training, because I think it's also going to be helpful to the medical field, because what we know about weight bias is that it occurs so frequently even amongst our colleagues.
Yes.
And that impacts patients. I've seen a number of patients who are like, yeah, every time I went there, all they did was tell me I'm fat, or, all they did was say everything I had was because I'm fat, and nobody
Hmm.
ever checked for
Yes.
anything else. And unfortunately, we do know that that happens, but that hinders the type of care that patients who may have a bit of extra weight would receive. And so important for recognizing those things. So thanks for highlighting all those points for us.
Definitely, definitely.
Yeah. And so something else, even within the medical field, while we're on
Mhm,
that subject, that sometimes is missed is that certain medications can have an impact on an individual's weight. And so
mhm.
with that in mind, what are some of those mental health medications that can commonly contribute to weight gain?
Yes, yes, yes. Thank you for asking that question. Great questions. So I think the most important thing to recognize is that not everyone will gain weight on medications that have a side effect of weight gain. Some people have different genetic makeup. Well, we obviously have different genetic makeup. People break down medications differently in their bodies, and there can be some environmental factors that are also contributing. So all of the medications that I'll list now are not always going to produce weight gain in, everyone who takes them. And so if we start with antidepressants, some of the most common ones that people I think about are like Paxil or paroxetine, one of our, oldest antidepressants. Also Zoloft, a very common one that I love to use as well. It's also known as sertraline. And another one that we actually use to its side effect benefit is a medication called Remeron or mirtazapine. And a lot of times we're giving this to a person who potentially needs a little bit of a boost in appetite, because one of its side effects, where you're using the advantage of that appetite stimulation. It also can produce some relaxation and rest as well. And so because of some of the different receptors that it hits in the body, those medications can cause weight gain. Antipsychotics. So antipsychotics can be used not only for psychosis,
Mm.
but we also use some of the antipsychotics for augmentation or kind of giving a boost in a depression medicine that a person may already be on. So And it can also be used for, mood disorders like bipolar disorder as well. So people can keep those
And
in
even
mind.
sleep sometimes.
And even sleep. In particular, I'm glad you mentioned that, because one of the ones that can be used off-label for sleep is Seroquel.
Yeah.
That's also known as quetiapine. So that's one of the common ones. And, I've seen some people, if they start at a lower dose of 25 milligrams and go to 200 milligrams and haven't had weight gain, the likelihood is they wouldn't have any weight gain at higher doses. But then you have some people who could be on 12.5 or 25 milligrams and they've gained 20 pounds. And so increasing that medication constantly may be placing that person at risk for excessive weight gain. Other medications in the same category, and these are the new school antipsychotics. The Seroquel is like one of the new school ones. There's Zyprexa. That one can be used, and sometimes it is used in combination with Prozac as a combination pill. There's a formulation out there to help with depression. And so Zyprexa is a very common one that can cause this heavy weight gain, and which also can unfortunately lead to other metabolic issues like blood sugar abnormalities and also cholesterol abnormalities, et cetera. You also have Clozaril. That's one that's really common. And there's another medication called Geodon. Now, again, I've seen a lot of patients who have been on the Geodon. I've seen some whose weight has shot up on it. And I've seen a lot of people who haven't gained weight on it. So it just always depends on the person. As far as the older school antipsychotics, the most notorious is Thorazine. And we actually may use that in the professional world that I'm in, in the emergency rooms. And if we have children who are having some agitation, Thorazine is one of the medications that we use as needed, but some children may get placed on it, so it may place them at higher risk of weight gain. We also have mood stabilizers. Some of the most common ones are like Depakote that people think of, as well as lithium. And so Depakote is also an anti-seizure medicine, but most commonly, we use it for bipolar disorder. We can use it for migraine headaches as well, in addition to the anti-seizure properties. And so there's another anti-seizure medication that can commonly also increase weight gain, and that's Tegretol. And then also gabapentin. Gabapentin can be used for anxiety, for mood stabilization, but also a lot of people know it as, being a medicine that helps with chronic pain and also nerve pain.
Yeah. Yeah. Thanks for summing that up for us. And just to highlight, this is why it's so important to see a doctor who is, specializes in this thing. And I'm excited to see that psychiatrists like yourself are specializing in obesity medicine, because it's so important for the doctor to understand that relationship too. Not that you won't prescribe these medications, but so that you're even more capable of counseling your patient effectively, on what may happen and how to prevent those things from occurring, or maybe even augment their treatment plan so that they can have maybe, some appetite reduction medication or something in addition, so that they don't experience that weight gain and those health complications that can even come from that. So good job, good for you for getting that additional training for the care that you're providing to the much needed community, the work that you do too.
Yes.
If you're frustrated with your weight, taking more medications than you'd like to, have been told that you are at risk for the development of a chronic preventable disease, or just are not feeling in the best of health, then I'm talking to you. Why? Because you're tired of fat dieting. You know it's time for a change, and you want a sustainable plan to improve your health. If you have found yourself at this place in life, well, I have developed a program that's just for you. It's called The Essence of Health, and it's your prescription for transformation. My goal with this program is to give you the tools needed to create sustainable lifestyle changes within a group coaching setting, along with one-to-one individualized coaching to give you a personalized path to health that's just for you. The benefits are priceless, so join today. Head on over to eohcoaching.com to learn more. The essence of health is in you. So what role have you found, Dr. Jamie, even within the mental health realm, that emotional eating may play in the relationship between obesity and mental health? And then how do you typically counsel your patients on emotional eating?
Another great question, definitely. So emotional eating can be a feature of some mood disorders like depression, I think most commonly people think someone's stressed out or depressed. And so you want to reach for, ice cream, or you want to reach for some candy or some comfort foods, things that just tend to make us feel better. We have all been there. We have our favorite, foods that are just comforting to us and that we may not even realize that we're reaching for when we get stressed out. So, of course, emotional eating, unfortunately, can contribute to weight gain, especially if you're leaving specific mental health conditions untreated, like depression or anxiety. And so, one of the things we do know is that having untreated depression or people who are not getting a lot of sleep, that's probably a lot of us, or people who have an abnormal sleep schedule, like people who work on a third shift, so who don't have regular sleep patterns, or people who are dealing with higher levels of stress, as we talked about, definitely can have emotional eating, and that can contribute to weight gain. As far as counseling patients on emotional eating, first start with the 5 A's of obesity management. I want to focus on the first one, which is ask. Ask for permission to have the discussion if the patient doesn't bring it up first. And so I'm really glad that, you expanded upon weight bias and the fact that it does exist amongst us as providers, in the medical community, because I have definitely heard, and I'm sure, again, you've heard the same thing, where a person has gone to their primary provider and the focus is you need to lose weight versus having a discussion with the patient, asking them first, do you want to talk about, weight management, or do you
Or
have any specific
what may
concerns?
even have been going on to promote that weight gain. Yeah.
Exactly. Just having more understanding. Exactly. And so the first thing I definitely do is ask. And once I have permission to move forward, then we can work with each of our patients to identify a pattern or a trigger that a person may have, and just bringing awareness to that and how that connects to the emotional eating. That's super important. So, a lot of times our lives are busy, they're on autopilot, and you just do things automatically without realizing it. And so taking a moment to be mindful really, really helps. And it kind of leads to my favorite phrase. So most people have heard of you are what you eat. My favorite phrase is you feel what you eat.
I
So
like it.
yeah, you feel what you eat. So mindfulness really is key. So paying attention to the foods that you're putting into your body, paying attention to, the things that you're drinking, that you're eating, and documenting how it makes you feel. People don't usually do that. We may just be eating mindfully. We're sitting in front of the computer and we're eating. We're, eating in front of the television screen. And it is obviously very much more common that you're going to be less mindful in those situations because you're not paying attention, you're not slowing down. And so just taking a moment to slow down and just to be mindful about everything you're putting in, slowing down your eating. Those are things that really do help with emotional eating and just really recognizing the triggers.
Yeah, that's so true. There was even a study that came out not maybe a year or so ago about people consuming more calories if they're doing things like scrolling social media or watching
Yes.
television, our favorite things to do while eating. But it's like what you're saying is because your brain at that point is not on what's on your plate. You're looking at that screen and you're just scarfing it.
Exactly. And, the other thing too about obesity medicine and having this general understanding that it is a chronic disease, this is not, oh, someone is just eating, and they have food addiction. That's not necessarily the case. Not every single person who suffers from obesity has an eating disorder. Okay.
Thank you. I'm gonna give you a round of applause.
They do not just eat there are so many factors that are involved in obesity and the development of it. So while it is not food addiction, there are areas where I would counsel a patient similarly to someone who has a substance use disorder. And the biggest thing that's similar there is that telling a person you don't have to keep going. So if someone has an alcohol use disorder problem, if they relapse that first time, it's like, okay, I've taken a drink, I might as well keep going. going. You don't have to keep going. It may be that you build in treating yourself so that you're not feeling guilty, because if you're restricting yourself so heavily, you're going to eventually end up just overdoing it, and going backwards. And that really does make people feel worse. So just if you're understanding where those triggers are again, and those situations that put you in a pattern of emotional eating, you can just build in some guardrails, build in a little bit of space. You want to do things in moderation, not all the time. So also other coping mechanisms, right? So if you are feeling stressed, down, upset, one of the things we know, we've got natural dopamine boost from exercise. So just walking. I'm not talking about going out and running or, doing insanity videos or just taking a simple walk can be very therapeutic. Or just using other coping mechanisms, things that you like to do. Do you like to just listen to music and dance around your house? If you don't know how to meditate, YouTube has all kinds of free meditations that you can use and
Some good
pull
ones
up.
too.
Yes, you can. There's so much out there. Engaging in spiritual practice. Sometimes just getting back to your own roots if you want to sit and pray and again meditate. Journaling. Some people like to journal. Just writing and getting some of those feelings out on paper is also very help. And again, as long as you're in a safe and comfortable environment, taking a walk or doing something to that effect that may reduce stress is always helpful as well.
Thank you. Yeah, that's awesome. Now we're going to switch the road we're going down here just a little
Okay.
bit.
All right.
And I want you to tell us a bit if there are any differences in the relationship between obesity and mental health based on gender or cultural background, those
Yeah.
differences there. And then how does that even factor into a manifestation of mental health issues related to obesity?
Absolutely, absolutely. And that's an excellent question. I'm glad that we're talking about it, especially during this July, which is also BIPOC Mental Health Month. So BIPOC meaning Black, Indigenous, people of color. So I'm glad we're having these discussions here. And then last month in June was Pride Month. So I do want to highlight a few specific topics here and just give some pretty startling statistics here. So yes, obesity has a disproportionate impact on certain racialized ethnic groups as well as other special populations. So for example, almost 50% total of Black adults and over 45% of people identifying as Hispanic and or Latino experience obesity. And that's compared to 41% of white adults. Pretty startling. Yeah. Amongst Indigenous communities, Indigenous adolescents have a 30% higher rate of obesity, and Indigenous adults have 50% higher rates of obesity when compared to their white counterparts.
Wow.
And a lot of that may be
that's 1 in 2 for our listeners there. Yeah,
absolutely. And this may really, for Indigenous Americans, this can be related directly to food deserts. They're created by remote locations of reservations. For Black and Latinx populations, Hispanic populations here in the United States, there is a direct link, as we know, with general health disparities to systemic institutionalized racism.
Right.
And so while the gaps have closed over time, clearly these are very, very startling numbers and things that we have to pay attention to. Also, if you're thinking about socioeconomic status, people who are living in poverty tend to have higher rates of obesity. But I did find one very interesting resource that showed that Black men who have higher income actually had higher rates of obesity. Now, this could be similarly related to the higher risk of development and mental health conditions in Black people, which is regardless of socioeconomic status. And again, some of that may be related to racialized discrimination, institutional racism.
That is interesting. I also wonder too if it's one of those things like, now that you gain more affluence, that you tend to associate, some of those the biggest steak or some of those more unhealthy foods too, and the we readily have easy access to a lot of these foods. So I also wonder
Mhm.
if, that level of affluence for, Black males who do have more prior income with that.
Yes, just having access. Correct.
Right.
Absolutely. That
Mhm.
definitely may have an impact as well. As far as educational attainment, people who have college degrees tend to be less likely to have obesity. And I'll link this specifically to the recent affirmative action decision. So if you can imagine that with the changing dynamic over time, it's going to be threatening the ability of people of color to enroll in college. It'll be very interesting to see, what happens in terms of rates of obesity and people who have lesser educational attainment as well. And so for LGBTQ groups, I found some studies from 2015, very, very interesting. So people who identify as bisexual tended to have the highest rates of obesity at almost 44%, but then the rates varied very widely between gender identity. So for bisexual women, 49% suffered from obesity versus 34% of bisexual men. Also, for people who identified as gay or lesbian, there was a total of 28% obesity. But again, women carried a higher burden of obesity at 37% versus 21% of gay men. And then also, if you break that down even further by racialized ethnic groups, Black individuals identifying as bisexual had about a 50% rate of obesity,
Mm.
followed by Hispanic women who identified as lesbian, and then Hispanic individuals identifying as bisexual. So they're even within an already minoritized group, you have these racialized differences as well, and disproportionate rates and impacts. So a lot of this can again be related to systemic racism, racialized prejudice, or discrimination, socioeconomic factors, acculturation stressors for people who are coming into the United States for the first time, and all of this can contribute to obesity and mental health
Right.
issues.
Right. Yeah. And, add in the fact of chronic stress.
Stress.
What we know, there have been some newer studies that have, come out about the impact of chronic stress, not only on our health in terms of cardiovascular disease, but even on our
Mhm.
mental health and obesity rates also. And that's interesting with the populations that you highlighted for people of color, LGBTQ community. We know
Mhm.
these communities are under chronic
Yes.
stress. And so yeah, it definitely, highlights that point of what this chronic stress can be doing to people. And so that's definitely important to know, and for us as a medical community and just being a good human to help
Mhm.
people, to reduce
Right.
that stress.
Right. And you also think about, and even going back to like the idea of bias and already having weight bias, but then when you're combining it with a bias against a gender identity or against your racialized identity, then that really complicates the picture. And so truly having people who are sensitive and humble to all of these issues to be able to treat people is super important.
Yeah, yeah. Thank you, Dr. Jamie.
Thank
All right. Now, before I let you go, what are 3 tips that you would give someone who may be challenged by obesity and a mental health condition?
you. Okay, that's a good note. Great questions today. The first one I'll say is don't give up. When it comes to having mental health conditions or suffering from obesity or having a combination of both, it can really feel helpless, and you're trying to work things out in terms of losing weight or recovering from anxiety and depression. Just don't give up. Know that there's help out there. There are resources, there's support out there for you, and so try not to give up. Having a trusting relationship with your primary care provider is super important and key because it can keep you motivated and moving towards whatever goals you have for yourself in terms of that recovery. Don't ignore yourself. Don't ignore things that are happening to you. It's really never too late to turn things around. It may feel hopeless, as I was just mentioning, but again, see your doctor regularly. And when you're ready, don't be afraid to ask them for help on that journey to try to figure out the best way that you can partner with them to improve your physical or your mental health. And last, just take baby steps. change happens one day at a time. Change is very, very hard. Don't beat yourself up if you go backwards. You can, build in those guardrails as I talked about before. And then also focusing on small daily goals. That's super important. Don't overwhelm yourself because those small goals can turn into larger ones over time.
Awesome. Those are fantastic tips. So, audience, I hope you're like taking notes, writing it down so you can reflect back on those things. Well, thank you so much, Dr. Jamie, for coming on the show. I really
Yes.
appreciate it. Now, first, are you accepting new patients? And if someone is looking for a psychiatrist like yourself, especially someone with that extra obesity medicine training, how can they connect with you?
So I am not actively practicing in a combined practice at this moment. A lot of what I use my obesity medicine knowledge and training for is within my active role and work that I do in emergency rooms and seeing patients in hospitals at this current time. However, there are a couple of providers out there. I don't have I'm going to send you the name of the one person
Okay.
that I know who's out there who I believe has a practice that is virtual, and she is, I think, quadruple boarded, and she's a psychiatrist, child adolescent psychiatrist, and also has obesity and lifestyle medicine
Awesome.
certification. So I'll refer you that way. I am not on any social media platforms like Facebook, Instagram, or TikTok, but at this time,
Which is
but
Dr.
people.
Jamie's excellent way of self-care.
Yeah, that is a part of my self-care process and journey. But people can follow me on LinkedIn. So if you go to LinkedIn, I am Dr. Evans Fam Psych. So it's DREVANS FAMPSYCH. You can follow me there.
Awesome. And I will put those resources in the show notes, including that other physician, so that folks can have a resource for someone like yourself who is certified in psychiatry as well as obesity medicine. Because I think it's such a great combination. So
Yes,
exciting. All right.
absolutely.
Well, thank you, Dr. Jamie.
Thank you, Dr. Shayla. Have a great one.
Thank you for joining me today on the Essence of Health Tea Time podcast. Click the subscribe button on your favorite podcast platform so that you never miss a moment of the Essence of Health Tea Time podcast. Check out the show notes to obtain your free tips for healthy living guide to get you started on your health and wellness path. Follow me on social media at Essence of Health Wellness Clinic on Facebook, Instagram, and YouTube, and at dr.tw@EOHWC on TikTok. Interested in becoming a member of the Essence of Health coaching program? Well, head on over to www.eohcoaching.com. The essence of health is in you.